It's exactly 12:38, and we're into the final interview of the morning. Now, a couple of weeks ago, we started the ball rolling on ivermectin. Alhamdulillah, we believe that government or the health department is finally looking into further studies and possibly, prescribing it on compassionate grounds. So there's good news at the end of the tunnel as far as that drug therapy is concerned, all in the hope of healing the nation and the world from COVID-19. Someone else that is doing his bit in the healing of or the prevention of COVID-19 is a homeopath. He is Dr. Chad James. He's based in Randburg, Johannesburg. He also has a practice, I think, in Krugersdorp. His wife is a medical doctor. Her name is Dr. Natalie. And we're going to hear why he believes that what he's come up with is possibly one of the protocols that one can and should be using in the fight against COVID-19. Dr. Chad, good morning. Welcome to the program. What a pleasure to have you here.
Good morning, Julie. Thank you very much for having
me. Anything and everything that we can do to rid the world of this pandemic is very, very welcome. You're a homeopath. Your wife is a medical doctor, I understand. Why and how did you come upon this? And as a homeopath, what is your view on let's start with that question first. As a homeopath, what's your view on this virus?
Well, my view is probably as any medical doctor or any healthcare practitioner's view is something that we have to combat, not just from a healthcare perspective, from the general population as well, to mask up, keep their distance from one another, sanitize and so forth as well. So it's everybody has responsibility, and everybody has a responsibility to try their very best to actually come with some solutions and get over this and get back to normality again. But I do fear that's going to take quite some time that we can see that. So
when patients come to you with flu-like symptoms, we're not sure if it is corona or not till they tested positive or negative. But when they come to you for flu-like symptoms, do you worry that it might progress into corona? And what is the treatment that you start them on? And is it effective?
Yeah, so first of all, you treat every cold and flu these days as if it is corona, first of all. So you have to put on your PPE. You have to make sure that you're able to work with patients in a safe environment. Obviously, you have to monitor their oxygen levels and so forth, but because obviously that's going to decide whether they have to be hospitalized or not. So it is safe first for yourself and the patients, and also very important to actually educate them what to do when they get back home, that they don't infect the rest of the family and so forth. Giving them a good period to actually seclude, incubate themselves away from a lot of other people as well, that they don't spread this virus. And treatment, usually, from my perspective, we would be using antiviral treatments, usually herbal, work quite nicely and help with the symptoms and so forth. But definitely, you're going to look at putting them on vitamin C, zinc, and so forth as well. So that's pretty much what you're looking at the moment, and just monitoring. That's all the person does. Most people pull through this without having to be hospitalized, and that's what people forget. It's a very small number that do actually eventually end up in hospital. But when they do end up there, it's for the worst reasons usually, and it's because of the vast numbers that's actually hitting the healthcare system at the moment.
You've developed an antiviral spray. Tell us about it. How should it be used? What does it protect you against? How often do you use it? And how did you come about this antiviral spray?
Well, the antiviral spray that I developed, it starts probably about 10 years ago. It wasn't really, and it wasn't really aimed at any specific cold or flu. It was actually for sinus relief and so forth during colds and fevers to as a decongestant. And a lot of my patients over the 10 years have reported to me, but listen, this antiviral spray, this sinus medication that you put us on helps us actually shorten the term or lessen the symptoms of the colds and flus that we do get. So I always took note of that. And then obviously with the outbreak of coronavirus, COVID-19, I started looking into this and seeing, okay, what are we dealing with as in this pandemic? And what is the current research out on the herbal medications that I'm using? And from there on, I developed something that actually inhibits the coronavirus RNA synthesis and the viral assembly and release of the actual virus. It actually is a good preventative. You actually spray it in, it's excellent preventative. But it's not to mean that you can discard your mask or your social distancing or anything. That's still primary. You have to carry on with that. But it is just another preventative there that's been quite effective, getting good results back from that. And then also, even people that do end up getting corona, at the end of the day, it has shown a lot of relief for these patients as well. None of them have been hospitalized. It actually helps with actual immune response in the body. It inhibits the interleukin-6 in the immune response itself, and that stops the actual acute respiratory distress syndrome that you usually find in patients that end up in the ICU and so forth. And that is what we think is actually happening there. So we hope that this very early days, and I just developed this initially just as a preventative measure for all my patients that come and see me and also to my colleagues.
So, Dr. Shand, I can't buy this over the counter, can I? I'd need to. I'd need a consultation with you. You check my overall health and well-being, and then, as a preventative, with everything else that you would prescribe for me, you would suggest that I take this antiviral spray.
Yes.
Why is it not freely available?
Because it's a very difficult process, and it's been a very short time. Usually, to get medication through boards and so forth take many years, and it takes a company to do that. Literally, I'm a one-man show. This is showing a lot of promise. These are early days. I am looking into this, looking if we can do some sort of research and speed up the process. I have been in contact with the FDA in America as well. They're very interested as well. But definitely, primarily, we're going to try and get it more evenly distributed throughout in Joburg, people that can get to me and actually get this medication. So I don't... what happens, we kept the price really low down on this, so that everybody can afford it. This is
yes, I'm pretty surprised at the price, and that is why I'm asking you if it's freely available, because I'd like to get my hands on some of this. Do you use it like an ordinary nasal spray? And
no, definitely not.
How do you use it?
You spray it in the back of your throat. What I usually suggest is before you go out, you don't have to use it around the house if nobody's been exposed and so forth. That's not necessary. So before you go do your shopping or go to work, anything, before you put your mask on, you spray 2 to 4 sprays in the back of the throat. That actually saturates that entire area. So it's another area just to another barrier that you're actually forming for to stop actual COVID-19 infection. And then also, whenever you are in contact with other people, medical practitioners that do use this spray, many do. I usually say that every time they remove their PPE or put it back on again, they spray again, and then also when they get back home as well. So it's very safe to use multiple times. And the idea is that we made it safe to use, that anybody with any pre-existing condition can use it. It just cannot be used during pregnancy. That we cannot.
Okay.
Issues of
any other side effects that you might have come across?
From the medication?
From the spray. From the spray.
No side effects. You really have to take incredible amounts of the sort of herbal product to actually get any sort of side effects. So no, so far we've had no side effects. Everybody's been fine on it, so that's good.
It's a natural product, obviously,
it's
so it won't interact with any other meds that you might be on.
No, it's working very nicely with diabetics and so those with hypertension. It's not a problem to use with that. I've used it for many other conditions with people on a lot of other chronic medications or other reasons at a higher strength as well, and it's never interfered with anything. It hasn't been recorded to interfere with any of those sorts of conditions or medications. So compared to the many other things that people are actually taking, like I heard you mention ivermectin and so forth, that are not being tested,
Yes.
that actually could be problematic the way they take the animal, the veterinary-based medication. That might interact, but not because we haven't found any sort of problems, interactions, or allergies yet. So
Dr. Shad, we are in a crisis situation. And when you talk about something that sounds so wonderful, it sounds like, it's something that we all need and we need right now. What are you doing to try to get it to market ASAP? You can't be holding back on this.
Yeah, so that's the thing, is to get anything onto the market and to make it safe for people, and that's incredibly important, actually. I'm able to distribute it now amongst patients and colleagues and so on, because it is a safe medication. It's been used for many decades, actually, and never given any problems. But because I'm only registered to dispense it from my dispensary, I cannot put it on, say, for instance, shop counters and so forth yet.
Yes.
So that is the next step, and it's a big step, and it's a long step as well. But we'll see what we can do to actually speed up the process wherever we possibly can. But yes, I mean, I feel that COVID is going to be treated and prevented from a multidisciplinary.
Absolutely.
You're going to be looking at vaccines are going to take. I think that the biggest thing is to actually get the vaccine rollout and really get it amongst the population. But obviously, we're talking about 7 billion people around the world, and with multiple vaccines, it's going to take a very long time to get them. So wherever we can add something to bring a herd immunity around, that's what we really want at the end of the day. Yeah. So it's good to see that there's a lot of people trying their best to actually put something out there to help out with this pandemic. And I'm happy to be a part of it.
Yeah, please keep us in the loop once you get to the point where, you can get it to market, because, I'm speaking to you from Johannesburg, you in Johannesburg as well, but obviously we reach out to people all over the country.
Yes.
And people are interested in getting their hands on the product, undoubtedly, because it being a herbal remedy, people will be more interested. I mean, people are so desperate, they're taking the veterinary ivermectin in liquid form. That's how desperate people are. So where you talking about something very safe, a herbal product, people will be more than happy to start using it. And I don't think it could be a moment sooner for it to be available to the masses of people. Yes. Your wife is a medical doctor. What does she say about it? I know that she's been using it on a regular basis.
Yeah, she's my guinea pig.
Right.
And she was actually one of the first doctors that intubated the first COVID patients in the country. So she's been exposed since literally day one in Joburg. And she's been using it, hasn't got, fingers crossed, touch wood, hasn't contracted COVID yet.
Yes,
well
please
has had a lot of exposure. So yes, I feel it has helped her. Nothing is 100%, nothing is guaranteed. I mean, about 500 patients, if not more, have been using it already. And out of that, 2 have contracted COVID. So it's not 100%, but 2 out of 500 is really not bad.
Absolutely, yeah. Mm-hmm. So for now, for people who are wanting to get their hands on the spray like I do have a bit of a sore throat. I don't think it's anything serious, but I have a scratch in the throat. I'll go and use some salt water, gargle with hot or warm salt water. But how do we, apart from engaging with, having consult with you, how else, what are your plans? We need to get this to market ASAP.
Yes. Yeah, see, at the moment they can directly contact me and get it from our practices. So I've got the 2 practices, and I try and make sure that we can get people to be able to get it freely there.
Could they buy it from the practice without having a consult?
Yeah, well, I'll just have a small consult. I don't charge for a consult fee just to buy this little bit of medicine, it's not the idea. The idea is to actually protect people. So, yeah, so they can come and buy it directly from the practices. I'll just check that there's no other problems, that they're not pregnant and so forth, or any strange allergies that we should be aware of, and so forth. But really, it's there are stronger herbal drugs that are more detrimental on the shelves today than this. So
I'm sure.
And I have problems with people using it. So they can directly contact me, and we can get it.
Okay, so you're making a lot of sense with that response, because what I'm hearing you say is pregnant women shouldn't be using it. And of course, people with any other comorbidities, it then does make sense for you. Either they consult with their doctor and tell them they're going to be taking this, or consult with you and take a history, and then you make the decision whether it's safe for them to use or not. So I hear where you're coming from. I know I'm putting pressure on you to get the stuff to the market, but I understand the logic in you wanting to do it the way you're planning to roll it out. Apart from this viral spray and all the other protocols that we, having to follow, is there anything else as far as you as a homeopath, together with your wife who's a medical doctor, believe that should be in the pipeline? I know you've mentioned vaccines, so you're pro-vaccine, which is a great thing. So am I. Anything else, apart from everything else that we already know, mask up, social distance, hand washing, all of that. What else do you believe should be happening?
I think people should choose very cautiously when they actually go out in public. I know we had a hard lockdown, and I remember the first day that they lifted the ban on exercising. I went for a run myself because I run. And I remember that day, it looked like you're walking through a shopping mall at Christmas time, like Christmas Eve, through the hallways of the shopping mall. That's how the streets looked with people running. And I thought, this isn't a good idea, so I returned back home. And that's what we have to avoid. When you start seeing large groups of people reminding one another, when you're standing in it, you remind one another, please keep your distance. We can talk from a distance. We don't have to stand on top of each other.
Right.
Don't breathe with the hand. I see a lot of people. I work a lot in the West End. I see a lot of farmers, and as soon as they sort of feel comfortable with you, the mask comes up and they shake your hand, and they're not being malicious or anything. It's just that's how we're brought up, and we have to just be more aware of what we do every day. But definitely masks, a good quality mask. I see a lot of people, the nose is sticking out the mask and so forth,
yes.
but that doesn't help. It doesn't help anybody to wear those sorts of masks. Surgical masks are better. I wouldn't say you're using N95s in public because the doctors need it when they're intubating patients and working with these patients. And we did run out in April when we desperately need it. So I'd say stay away from those. Surgical masks are better, good quality masks that you're using that fits your face properly. And definitely sanitize all the time. And only when it's necessary. And so forth.
And how do people get hold of you? Do you have a website, or do you want to share a telephone number with us? Obviously, if they don't manage to get it, they can contact us and we'll pass on your details. Is that okay with you?
Yes, directly to me or on my email address. I don't have a website, unfortunately.
Okay.
But email or phone, WhatsApp or phone, that's perfectly fine. We can take it from there. Okay.
Just as a matter of interest, I don't think I've ever consulted with a homeopath, but if and when I do, how long does the consult last? Do you, like medical doctors, also take down a history and, what happens during this consult in terms of treatment options? And I should imagine with homeopathy, the results would take, I don't know why I've got that stuck in my head, but the results would take a little longer for you to see, or is that just a myth?
No, not really. That's literally, you can start seeing results almost the same day in some cases. It depends on the condition. If it's more acute conditions, you'll usually find the results are really quite immediate. But chronic conditions, you have to remember, if you're suffering with something for the last 20 years, it doesn't just disappear overnight. And that goes for conventional medicine as well. But definitely the consult is long sometimes. If you've got a long history and it's associated with whatever the patient is suffering from, yes, the history can take up to or history taking the consult can take up to an hour if necessary. But if it's necessary. But I do a lot of sports injuries and arthritis and so forth, and they may take 10 minutes, 15 minutes. It doesn't take long because we're injecting a specific area or working with a specific area that doesn't need a long consultation. So it depends on patients, it depends on the condition, and also is it acute or chronic at the end of the day.
Okay, finally, I know that you're going to obviously patent this spray. You have to. But some of the components that is included in the spray, one or two, if you can just mention to us, if you'd like to.
Yeah, like I said, it's a herbal complex. It has homeopathic remedies in it as well. And most of them are focused at actually alleviating symptoms of colds and flu, like I said, from the beginning, where it originated from. But you're looking at your BBR sort of alkaloids that are usually sufficient to actually help with coronavirus itself, with the RNA viruses, and actually have an impact on that. So we actually went and found the herbal products that specifically have those alkaloids in to actually counter these viruses at the end of the day. So it's very specifically focused on that. Like I have had recently a patient with a bacterial chest infection. Obviously, we all thought immediately this is COVID. It came back as something bacterial. It does not work for bacteria. Unfortunately, it was not made to do that. It's specifically made
this
for
is antiviral.
Yeah.
Okay. What about people with asthma? Is this going to help them? Is it going to assist them?
I have had some reports back from the East. From Malanga, a few patients had asthma down there. I imagine they are from the coal mines and so forth, with lung problems. And they said it had alleviated, but I think mostly it had, because it has an effect of being a mucolytic as well. So it does open up the sinuses, because that's what it originally started as 10 years ago. Without us knowing what the antiviral effects it might have. But definitely, they have said since that it's opened up their respiratory airways a little bit, with nose and sinuses and so forth. But it has helped their asthma users. It's safe for them to use as well. That's not a problem. I've had a lot of asthma users, sufferers actually on this medication.
Brilliant. I'm going to be in touch. I need to buy a couple of bottles over the counter. So I'll be giving you a call. And good luck. It's so heartening to hear that there is another something else on the market that can help protect you against this virus. So go well and all the very best. And please, once you've had approvals and so forth, give us a shout out here and we'll talk some more about it.
I will, definitely. Thanks so much.
Thank you. Stay safe and bye-bye.
Bye-bye.
That was Dr. Shad. He's a homeopath. He has a practice in Randburg, Johannesburg, and he also practices in Krugersdorp, talking to us about an antiviral spray. Can't wait to get my hands on it because, as I've told him, I'm sitting with a scratchy throat. But, and of course, I'm going to share the information with you. I'm going to use it and tell you guys what I thought about it. But that, of course, brings us to the end of the show. Thank you indeed for being with me. I do hope you've enjoyed all the interviews. So next week at the same time, please, please, please stay safe. That means washing your hands, social distancing, wearing your mask. And if you can get hold of this antiviral spray from Dr. Shad, then get it and start spraying as well. Till the next time, as always, Assalamu alaikum and Khuda Hafiz from me, Julie Alli.